and welcome to our guests. I was very keen to have this session, mostly because I'm interested in evidence-based design, and to be honest with you, I had quite detailed questions around that, but I think we might need to start at a different place, because I hadn't really realised that we hadn't gotten to the start line on some of the projects when it comes to, you know, digital e-health. So could we go back to that discussion a little bit? So sorry, just to be clear, the business case for the EHR was rejected when?
2018. Okay, and basically, if I say, put it this way, what Department of Public Health Expenditure said, they wanted to see the outcomes and the benefits coming from the investments that we made in Children's Hospital prior to making national investments.
I'm sorry, could you repeat that? Sorry, okay.
Yeah.
The department said to you that we will not give you the funding, or we will not give you the capital funding to go ahead with this vital project until we can see it in operation in the Children's Hospital, which is massively overrun in time. So that's where the business case fell down, is that they couldn't prove it, even though that it's operating in all the countries all around the world, and that's how good health systems work. They couldn't prove it because it wasn't working in a project that actually wasn't even up and running at the time. That's what we were provided with, that they wanted to see the outcome of the Children's Hospital and the benefits and the realisation around that. And that was in 2018, and we're in I know everybody in the room knows this, we're in 2023 and that hospital is still not open. Okay, how long does it take okay, so since 2018, the business case has been rejected. Are you still waiting for it to be in operation in the Children's Hospital before we can move forward?
Well, we're hoping to try and sort of bring that around again, Deputy. Okay, so we are working with the Department of Health to say starting a strategy around that, putting that in.
I know we're nearly at the end of the era of getting the Children's Hospital complete, but it will still take, I mean, you'd need 12 or 18 months of data to make that case if you're going to use the Children's Hospital, so that's pushing it far, far out. So I guess my question to you is, surely the department can see that that is not a reasonable way to make a decision here, and if they accept that point, how long will it take you to do the business case? How long did it take you in the case of the newborn partnership with the US company, for example? And how long will it take you to move through the procurement process?
So the approvals process and business case we will be updating the 2018 business case, because in my view, it's a sound business case. It will need to be updated and modernised.
Have you done the updating of it?
Not yet, Deputy. No, we haven't. Okay.
But you've known since 2018 that it wasn't fit for purpose, that business case.
Well, we believe it was fit for purpose, Deputy. Okay.
Did it refer to the Children's Hospital, the business case?
Yes, it would have, because
okay, it would have so then it's not fit for purpose, though.
No, but it needs to be updated around that. So we're included, okay. and a separate business case was undertaken for the Children's Hospital, and we will, take those two, merge them together, and have a national business case. But we're only talking about acute.
I mean, the business case for ICT in the Children's Hospital must have been written down in 2009.
No, it was the EHR business case was updated, okay, in 2019, 2020.
So you're still linking the rest of the EHR to the Children's Hospital?
We're not linking it.
Okay.
So the huge learning will come from the Children's Hospital. There's been huge learning from the work that we've done in James.
Okay, but in the case of I don't mean to cut across you, but okay. I have only 6 minutes. In the case of electronic healthcare records, to learn from that process with the Children's Hospital will have to be running, and we will need a certain cohort of data, right? So how do we move past, how do we get this starting now without having to wait 18 months or 12 months for the hospital to be open, which, by the way, it won't be open until the middle of next year, possibly, once we're into the era of, or the time of commissioning?
Yeah. Well, I suppose, Deputy, we won't, I believe we won't have that evidence for, as you say, for a period of time, okay? But we will know that we have configured and delivered on a solution, okay, which will work and is implementable, and therefore we will be able to, utilise.
How do we know if an EHR system is working if we have no patients to test it against? If it's simply just commissioned in the building?
Well, we would be able to validate that, utilize two things, I suppose. One,
Mr. Thompson, I know about commissioning in healthcare buildings. You need to have an occupancy record to show that it's actually working. It requires at least 12 or 18 months.
Yeah, I'm not saying you won't have all of, you will need all of that, okay, but you will be able to show that we have a functioning, working system. Okay?
So we're still waiting for that system to be in place before we move to the business case for the rest of the healthcare system and a procurement process.
Part of what we want to do, okay, is there are two things. One, we want to do the patient portal, okay, and bring that through the process, and then we will then start as well looking at an updated electronic healthcare record.
Okay, can you give me a timeline for that?
A timeline for the starting of our working through it, okay?
No, a timeline for the completion rather than the starting.
I can't, Deputy, no.
A ballpark.
So
okay, let's start with when you're going to start.
So the deployment of an electronic healthcare record nationally will take between 5 and 7 years.
Okay, but we've been working on this since 2013.
So we haven't, once we didn't get approval on that, I say we pivoted and we were not working on the electronic healthcare record nationally.
So from 2018, all operate, other than the newborn system, all work on electronic healthcare records ceased?
We would have gone into deploying tactical solutions, okay, in order to...
What does that mean?
Well,
hospital by hospital?
Point solutions, okay, so we would have deployed lots and lots of solutions, okay, upgraded our radiology solutions, we would have deployed renal solutions, we would have deployed endoscopy solutions, these are point solutions within either hospitals and or national.
But Mr. Thompson, isn't the point of the electronic record is that it's global? As in, not global in terms of, country, I mean global in terms of it encapsulates all information. So if it continues to be spot for at least 5 or more years, I mean, what is the benefit to the... It seems incredible that we're here now in 2023 when we set off on this journey in 2013, and it seems we haven't even started the work.
So we've made lots of progress in our tactical solutions, okay, and we are bringing those together into our patient portal, and that's what we want to do, okay. And I say, when I said to Deputy Shortall about the starting line, we can't implement something we don't have approval for.
No, I completely accept that. But my point to you is it a flawed methodology to link this to a particular hospital when that particular hospital has been desperately delayed for many years?
In an ideal world, okay, we would have been allowed to proceed, okay. It's not us who are linking it, right? In an ideal world, we'd have been allowed to proceed, but we're not, and we are who we are as a result of that. Okay.
I mean, I would like to be here asking you more detailed questions about the operation of it. I mean, I had many questions around, the capacity for data collection and how we link staffing to that. But I don't see that there's any point in doing that when we're at this stage.
Well, can I say, Deputy, on some of those questions, I mean, we do have a really sophisticated data lake where we take data from multiple systems and are able to join that together, right? To provide really good insights across a whole range of areas, okay? So, we'll be taking HR data, we're looking at capacity data, and we're able to match that and map that across our systems. Okay, well, given that we are going to be talking to another group after this, how will the health service records or the electronics records be deployed for the sake of that, that issue of evidence-based decision-making, disaggregated data? I mean, I sit on lots of committees and it comes up almost every week, the lack of disaggregated data, and obviously yourselves and social welfare are the key players here on that. So, the data we have in our data lake, we have the ability as a really sophisticated data lake to aggregate that data, to examine that data, and we use it both internally and we use it for published data as well, okay? We also have a separate clinical data stack, which is managed and run. Okay? And are you making headway in establishing research support functions for universities, for whoever might require that disaggregated data or any data? So there is a research part of the HSE, okay, who work with those colleges and whatever, okay? Up to now, we haven't provided access to
Is there plans to when the EHR is fully operational?
So part of the EHR programme would be to enable that to happen.
Chair, I just want to get one quick question is, what's your knowledge? I don't see any discussion around the Health Information Bill in your opening statement. Are you working with drafters on that? Are you involved in that process?
So the Health Information, we've been consulted with the Department of Health.
When was the last time you were consulted?
I have regular meetings with the Department of Health, okay, around that, okay. So it might have been very late last year. We would have had some discussions around that, okay. So
2022, you mean?
Yeah. Okay. So we'd be aware of what's in the bill, and we're very supportive of where it's going.
Okay, thank you.
Just before we go on, do you think it'd be helpful as a committee maybe to try and get make some sort of sense out of that 2018 decision by DIPA?
Are we allowed to get a business case or a rundown of the reasons why it was rejected?
We could ask, anyway, can we?
I think the committee should write to the department seeking an explanation as to what their rationale was for delaying it until after the Children's Hospital, given the amount of delays.
Even linking it now will delay it.
Chair,
sorry.